Hello, everyone. Also, I am holding my phone because my phone is on the charger. It's on 1%. For this assignment, I chose breast cancer as like my health interest for my annotated bibliography video. So this topic is very important to me because my mother, years ago, was diagnosed with breast cancer, and it really affected my family because cancer, a lot of people die from cancer, and we thought that she would unfortunately not beat it. But my mom is a very strong, independent, powerful woman, so she was able to go through what like every other breast cancer patient went through: multiple screenings, diagnosis, chemotherapy. Big emphasis on the chemotherapy, radiation, and survivorship. Each of these stages provide different care navigators, providers that are very specialized in these areas, and you go for many appointments, decisions, and care navigators play a very important role in helping patients manage these steps, understand medical information, and overcome barriers that might otherwise delay care. And you don't want to delay care. So in this video, I will discuss 3 peer-reviewed journal articles that are related to breast cancer care navigation. Rather than just summarizing each article, I will discuss them together in an applied real-world context, focusing on how care navigation patients and where limitations exist. So the 3 articles I have right now are Robinson and White, Patient Navigation in Breast Cancer, a systemic review published in Cancer Nursing, published in 2010. Marshall, Effect of Patient Navigation on Breast Cancer Screening Adherence, published in the American Journal of Preventive Medicine, published in 2015. The one published in 2012 is by Hoffman, who wrote about patient navigation significantly reduces delays in breast cancer diagnosis, published in the Journal of Women's Health. So let's get into the first one with who is he? It's Robinson. Forgive me, I'm so sorry. So across all these 3 articles, the central finding is that care navigation improves patient follow-up through breast cancer care. Robinson and their colleagues conducted a systemic review and found that navigation supports patients throughout the entire breast cancer trajectory. They state navigation across many aspects of the breast cancer disease trajectory improves adherence to breast cancer care. So in real-world terms, this means patients are most likely to attend mammograms, follow up on abnormal results, and continue treatment that they have someone guiding them through the system. For example, a woman who might receive an abnormal mammogram result may feel very scared or confused because they don't want to die. They don't want to leave this earth at the moment, and they will delay follow-up because of their mental state. A care navigator can explain the result, schedule the next appointment, and help ensure that she does not fall out of care. So if we'll go to Marshall next, they focused specifically on breast cancer screening and found that patient navigation significantly improves screening adherence. So they follow up with the research that navigation programs increase mammography rates, particularly among under-reserved populations. They state that patient navigation interventions improve screening mammography rates in medical and urban settings in our participants who were racial and ethnic minorities. I'm so sorry about that. Forgive me. So applied to patient care, this means that navigation can directly increase early detections of breast cancer, which is strongly associated with better results. We love better results. So from the patient perspective, this could mean receiving reminders, help scheduling mammogram, or assisting with transportation. All practical supports that make screening possible. And for my next article, the last article by Hoffman, colleagues examined how navigation affects the time it takes for patients to receive a diagnostic resolution after abnormal screening. Their findings show that care navigation can significantly reduce delays in diagnostics. So they reported that navigation significantly reduced the odds of having diagnostic delays for women, regardless of insurance type. So in applied practice, this means reach biopsy, diagnostics, and treatment decisions faster. If you want results better and to get cancer out of the way, you need to get these done quick. And this will reduce emotional stress and improving clinical outcomes. We love improved outcomes. As someone who's like mother went through breast cancer, I understand how stressful waiting for results can be. And but with reducing diagnostic delays can make a meaningful difference in the patient's outcome. So how can these resources be beneficial to patients? Together, they can improve screening adherence, reducing delays in diagnostics, increasing continuity of care, helping patients manage healthcare systems, and addressing social and structural barriers. Overall, if you need to get this done, you need to listen. You really need to listen because this is life threatening, and if you continue to delay this, the survival rate is going to go down. So, for individuals navigating breast cancer, care navigators provide not just information, but guidance, advocacy, and emotional support. They are there to help you. They went to school to help you. But these articles lack acknowledged limitations. Navigation programs require sustaining funding, trained staff, and institutional support. Now, healthcare systems can maintain these programs long term, which is unfortunate because last discussion post I talked about how cross-cultural practice needs to be more taught in healthcare professions so we can better understand our patients. Additionally, care navigation cannot eliminate systematic issues such as insurance denials or provider shortages. Though it can help patients manage them more effectively by just not freaking out as much. In conclusion, these three articles demonstrate that care navigation plays a critical role in breast cancer care. By helping patients move through a complex and emotionally challenging healthcare system, the greatest contribution of care navigation is the ability to reduce delays, improve adherence, and support patients at vulnerable moments in their life.